Well, welcome. Tonight we're going to talk to somebody about an interesting part of the medical field, sports medicine. I think we all think we know what sports medicine is. We all hope we never have to use it, but let's start with an introduction.
Hi, thanks for having me. My name is Amy Costa. I am a sports medicine and primary care physician here in Milford.
Now, Costa, nice Portuguese name.
Not in my family.
Ah,
So I apologize to about 50% of my patients when I walk in the room that actually I'm not Portuguese. In my family, it happens to be Sicilian.
that's funny because you do a name like Costa here in Milford.
I know.
I bet a large population just starts talking to you in Portuguese right away.
I might have to learn some Portuguese.
Well, you live in Milford.
Yeah.
So, Amy, what is sports medicine?
Good question. Um, so we like to, I would say, for the purpose of understanding, um, I think about sports medicine and sports orthopedics. So there are orthopedic surgeons who specialize in repairing surgical injuries related to sport. And then there's primary care sports medicine, which is what I am trained in. And I can manage any non operative or non surgical musculoskeletal injury, typically related to sports, but sometimes related to work or other life events.
I remember the first time it was Velasquez.
Mm-hmm. Yes. Yes, yes, yes.
He stuck a harpoon in my knee and took out two very gigantic syringe full of fluid.
Yes.
That was my first introduction to sports medicine.
Yes. Yes. So yeah, Dr. Michael Vasquez is a sports orthopedist who trained in New York City with some of the big football teams and now works in the same
Well, I got
office.
to admit, I went in, my knee was not healthy, and it's my own fault trying to play hockey with young kids. You'd think you'd know better when they're third your age or half your age. But Mike just had a way about him, and
Mm,
but somehow when I'm looking at that syringe and he just keeps pulling more and more fluid out, it's like, what was that
yeah.
about?
Yeah. Yep. Yep. Yep.
So, typical day in a sports medicine clinic.
Yep. So typical kind of 9 to 5 day, more 8:30 to 4:30. We see patients. The office has X-ray right there. Most patients will need an X-ray because it's an injury typically. So they'll come in, they'll see our front desk staff and our X-ray technicians and have an X-ray done, and then come back to see me or one of my colleagues. Um, I'll want to know what happened, all the details, and then examine them and come up together with, a treatment plan that works for them and just see patients kind of straight through the
Now,
day.
is it mainly injury or is it just people like me getting older and not admitting it?
It's a little bit of each because even people who are older typically come in when something happens, like maybe their knee has been hurting for a few months and then they played hockey or did something with one of their kids or grandkids and then their knee blew up and that's when they come in. So there's always some sort of inciting event.
Yeah, with me it was tearing the ACL.
Oh no.
Yes, Mike then
Yeah.
asked me, Dr. Velasquez then asked me, well, what did you do? I said, I waited a week. He goes, then what? I said, that was it. It was playoffs. I wasn't giving it up. So not one of my more intelligent moves.
That is not uncommon.
But now, I remember the first time we went to the practice, it was still Mulroy.
Yes.
And Dr. Mulroy
Yes.
replaced both my mother's knees.
Nice.
It was amazing the way he did it and how he did it and the results.
Yes.
I never thought I'd follow my mother into the practice.
And hopefully you won't need a knee replacement, but he's still practicing. Dr. Mulroy is still practicing in the office as well.
Well, since then, I've torn the other ACL and the meniscus, and then finally I said, okay, there's a hint here. Playing with 20-year-olds is not a good thing to be doing.
Probably not the best choice. But, we are big fans of people continuing to move, do the sport they like to do, ideally in a safe way. Maybe not playing with 20-year-olds, but playing in like an old man's beer league or something and keeping moving. That's real important.
But now, what's the biggest reason somebody comes to you? Is it
Yeah.
deterioration of the joints or is it injury?
I see more people for injury than it's like I said. There's always some component of injury. Like maybe their joints have been worn down, but it's usually injury. There's some older patients who just come in because something's been hurting for a long time, and they want to know what to do to make it better. But most of it's injury. You know.
Is the injury the catalyst? I
Yeah.
mean, is it
Yeah.
something that I know my knee's been deteriorating
Yes.
or my joints been deteriorating, but I'm a manly man. I'm not going to admit it.
Yep.
You know, that's
Yep.
terribly sexist, but I can admit to being an old manly man who doesn't want to admit he's getting old.
Yep, yep. And then usually it interferes with life somehow. So, I can't bend down to reach something. I can't wash my hair. I can't, do something that's imperative for life. That's another thing that'll bring people in, especially as they get older. But we see all ages. We see younger people too.
Yeah, my daughter bought me a sock putter on her. She's decided that I should exercise. My cardiologist has said I got to do 30 minutes a day.
That's good advice.
So she comes over every day, at least 5, 6 days of the week, and she can run. I can hobble. So we get on the bikes together and the treadmill together. And for me, it's easy. I'm with my daughter.
Yeah.
What more could I want?
Yeah.
But now, when you think about, all kidding aside, what should somebody, as they're getting older like me, I'm 65 years old, what should I be doing to maintain myself?
Keep moving. Keep moving. So, the general advice for all ages for exercise is 150 minutes per week, so about 30 minutes, 5 days per week.
Right.
What that is changes over time. A 20-year-old might be running, 4 or 5 miles in 30 minutes. Someone else might be walking, a mile and a half in 30 minutes. But whatever that is for you, whatever's appropriate for you, you should be doing some exercise. As people age, not only is that cardio type of exercise important, but also balance and strength. So as people age, they naturally lose muscle mass. It's just something that happens. It doesn't have to do with diet or doing something wrong. Older adults just lose muscle mass, and as you lose muscle mass, you lose strength, you lose balance. So any exercise you can do to help with that, and that depends on what interests you: yoga, tai chi, just some body weight strengthening or some weighted strengthening, single leg things, squats. There's studies that show your ability to stand from sitting is a good marker of health as you age. They should be able to get up out of a chair without too much trouble. So just moving, whatever movement
I'm
works
glad
for
you said without too much trouble, because if I can't get out of a chair, I'm in deep trouble.
Yeah.
I don't know if my darling bride would rescue me. But now, is there general exercises or general things depending on, okay, I'm just getting old.
Yeah.
So, I put a gym downstairs because my son-in-law and my daughter like to work out in the gym.
Nice.
They have my grandson and granddaughter with them. They can't work out with the grandkids, so they force us to play with the grandkids while they work out. Then all of a sudden, my cardiologist, I had a bit of a nuisance. I had a quaternary bypass.
Oh, goodness.
Yeah, it was annoying. Caused me to lose a day of work and all. He started telling me I have to go 5 days a week, 30 minutes a day.
Yep.
So now my daughter comes over and watches me, and I can tell because she's on the treadmill on one bike, and her legs are going a mile a minute. And my legs are just kind of chugging along. I feel like driving Miss Daisy. But,
Yep.
That's, to me, just overall cardiac activity.
Yes. Yep.
Is there certain things that if I've got an upper body deterioration or injury, I should do more than if I have just a lower body or I'm just old?
Yeah. Oh, good questions. All good questions. So in terms of cardio, popped in my head as you were speaking. Your cardiologist might give you a heart rate goal. So instead of worrying too much about how quickly you're turning the pedals, you want to aim for a certain heart rate goal, and your cardiologist could tell you that. Generally speaking, you want 220 minus your age is your max heart rate, and then you might want to be 60 to 70% of that max for your heart rate in beats per minute. So that's one, marker for cardiovascular. If you have an injury, something that's sore or painful, typically I would suggest seeing a physical therapist, and a lot of times you have to get a referral for a physical therapist, but seeing a physical therapist, letting them evaluate you, teach you those exercises, and then you can maintain them.
But now wait a minute, 220
Yes.
minus my age,
Yep.
so I'm supposed to be down at 155.
Yep.
Okay, I'm on my bike.
Yep.
How do I count 155?
Oh, you get a watch. Or you get a heart thing or a Fitbit. If you don't have those things and you don't have carotid artery disease, you can push right here and just stop and count maybe for 15. You do need some sort of timer. Count for 15 seconds and multiply it by 4.
But I can buy,
You can buy
what
it.
you mentioned is not very expensive.
Not expensive. Yeah.
Most people, because too many times you see these wonderful contraptions and you say, it's only $3,000.
Right.
It's like, really? And the average person can just go to their drawer and take out $3,000?
Nope.
But if it's something like a Fitbit or
Right.
a watch.
Right. And there's tons of commercial also because of COVID. There are those oxygenation measurement
Oh, that little
devices.
thing
The little thing on the finger, that gives you a pulse too. So a lot of people bought those.
I always look at it because it says 98.
Yes, 98%. And then usually there's another number.
Oh, I didn't even know.
Usually, so, yeah.
When I go in for my checkup, they're always, okay, we got to do the blood pressure.
Yep.
And I'm like, okay, 123 over 80. I'm here. You make me nervous.
Yes,
So I'm going to be 130. And
Yes.
sure enough, you get to a
Yes.
point where you can predict it.
yes. You know the number.
And I
Yep.
always love it when the primary care doc will say, well, why are you nervous? I said, oh, let's see, you're going to stick me, you're going to harpoon me, you're going to tell me that I'm old and I need to do more exercise. Why would that make me nervous? So I have a goal of 220 minus my age,
Yep.
60% of that.
Yeah, 60, 70% is a general marker. Someone who's at a bypass may have different recommendations from their cardiologist, but as a general marker, that's good pace for older people.
Now I've got a great cardiologist, Bill Shine, that
Yes.
will look at me and tell me, get off your duff and exercise.
Yes.
And he said, I really don't care what exercise you're doing.
Yes.
Get
Yes.
that cardio going 30 minutes a day, 5 days a week, and I'm happy.
Just get moving.
And he was right.
Just get moving. Yep. Yep. And it can be anything. It can be walking. You don't need, like you were saying, you don't need a $3,000 machine or fancy equipment. You can put on your sneakers and walk around your neighborhood.
Yeah, actually, I found the best thing is my daughter bought this big TV and a Fire Stick or some stupid thing, and she picks a series that we just watch together.
Yeah.
And it
perfect.
makes it go quick.
Makes it go quick. That's the other thing. It has to be something you enjoy. The only way to have an exercise habit that you can maintain is something that you enjoy. If you don't enjoy it, you won't do it.
I think that was at first because it was work to go down there.
Yeah.
But now that she comes over,
Yeah.
I get 30, 40 minutes with my daughter
Yep.
and some time with my grandkids.
Yep.
It's worth it.
It's totally worth it. That's excellent.
So now, let's start with, I've got knee problems.
Okay.
What would you recommend for exercise?
A lot of knee troubles can stem from hip troubles. So a lot of times what you need to work on is strengthening the muscles of the thigh, but also strengthening muscles of the hip so that you have good alignment. And for some people, it also means strengthening foot and ankle or wearing some orthotics also to help with alignment of the whole thing. And stretching's important too. So stretching and strengthening the muscles around like the knee and the hip and the ankle. And that's where if you went to a physical therapist, they could give you a set of exercises and then you'd know what to
Yeah,
do.
they gave me this rubber band
Yep.
that I have to stretch my legs out
Yes.
and do kind of a
Yes.
crab walk.
Yes. That's for your hip strengthening.
Oh.
Yeah, monster walk, like where you put it across and you step.
Yes.
Step, monster walk. That's for your hips. And that'll help your knees because it'll help alignment.
I
It's a
never
good
knew
one.
that.
That's a good one.
I just thought he was trying to annoy me.
It does feel silly to do those.
Feel silly? I'm a 60-year-old man crabbing along. Okay, so what else should I do to strengthen my legs?
Let's see. Bridges are good. Bridges are when you're laying on your back in a sit-up position and you pick your hips off the floor and put them back down. So it's, it's pretty easy on the body. It's a hard position to get to, but it's easy on the body and you're laying down. Bridges are real good. Wall sits are a good one that's kind of safe. So literally sitting against a wall in the chair position, but your back's against the wall. If you hold that position, it's like holding a plank. It needs a lot of strength. So that's a good one. RDLs are good if you have weights.
What's an RDL?
Yep. So Romanian deadlift. It's
A communist deadlift?
without standing up. You're basically hinging at your hip and lifting some weight. And it's great if you can do them one-legged. You want to do it one-legged if you have the balance to do it and something to hold on to. But you can do them one-legged, and that's good for balance too. So those are some good ones. You know what else is really good? And I'm not plugging this because of any reason, but there's an exercise book that Ruth Bader Ginsburg wrote with her personal trainer. And she probably wrote it 5-10 years before she passed away. So it's very geared towards the older adult. It's fantastic. The exercises in there are fantastic. And they walk through doing them without equipment or with equipment, depending on what you have.
I think that's one of the keys.
It's really
is
good.
Not everybody can afford
Yep.
fancy gym and
Right.
things on that line. I mean, I
Right.
saw the treadmills. They take you with movies, and it's like, seriously?
Yeah. Just go outside and walk, as long as it's safe.
Well, I have the TV in front of my treadmill. It takes me on walks anywhere I want to go.
Yes.
And I don't have to pay.
That's pretty cool.
It was something like 50 or 60 bucks a month
Just to get the TV show. Never
to
mind
get
the
the
treadmill.
little tiny screen.
Yeah. Yeah.
I mean,
Yeah.
I guess it's nice, but
But you can exercise without it. Yep.
what are the most common ways people injure their legs?
What age group?
Ah, well, I would imagine you start with the mid. Well, how? Why don't you tell me? Because if I'm thinking of the young kids, I was immortal when I was a child.
Yep. Yep.
You bounce off people,
Yep.
bounce off the boards on the hockey rink.
Yep. 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 So kids, did you say knee or legs for injuries?
Pick one and go to the other.
So little kids, they tend to protect their joints and their so if they're doing what we call free play, not on a team, not during a game, just playing with their buddies, if they hurt something, they will protect it. They'll limp, they'll go home, whatever, they'll protect it. But if they're in a game or a competition, sometimes they'll keep going. And little kids, like you said, are kind of bouncy. They have open growth plates, very stretchy tissues, and so usually if they injure something, they injure a growth plate. And really, it's a matter of rest, unless it's like a major, fall or something where they break something. So
Now, what's a growth plate?
so it like the end of the long bones, it's how it's how we gain height from childhood to adulthood. The bones kind of grow at those two ends, at those areas of bone growth, and then when you're teenager, young adult, that's when those growth plates close and fuse, and then you stop growing. So it's a weak point because it's where bone is growing, and so that's usually where little kids will get injured. I mean, they can have ACL tears and they can have other weird things, but a lot of times it's that.
Yeah,
kind
but the
of
kids
injury.
bounce.
They bounce. That's the thing. They bounce. Yeah, they bounce. So kids bounce, and then as you get into older teens and young adults, especially in team type sports, you see a lot of ACL tears, the one you worry about the most. You might see meniscal tears. You see a lot of sprains around the knee, like an MCL sprain, medial collateral ligament on the inside of the knee, patellar dislocations, lots of ankle sprains. Everyone sprains their ankle, I feel like, at some point in their 20s. Some overuse injuries, iliotibial band injuries can irritate at the side of the knee or the side of the hip. Sometimes Achilles tendonitis, Achilles inflammation. So that's sort of like middle age group. And then as people age, it becomes more an issue of wear and tear. So early arthritis, my right knee swelled and hurt so much during a soccer game recently that I had to pull myself from the game, which I've never done. in my whole life. And it turned out I had, a defect of some cartilage on the backside of my kneecap. So, it's more of a wear and tear thing. It wasn't like I tore my ACL or I tore my meniscus, but it was a wear and tear thing that just finally bothered me enough to get it checked
So you
out.
still play soccer?
I still play soccer. I
I
do.
finally had to stop. We were a soccer house.
Nice.
We inherited 4 daughters who played. Now my kids, my 2 daughters played local soccer.
Yeah.
And the Premier League soccer.
Yeah.
But then we got 4 inherited daughters who played a lot more serious level.
Okay.
3 of them played on the U.S. national team,
Nice.
and 1 played on the Canadian national team.
That's amazing.
Yes, I tried playing with them once, and I tore my meniscus. It's like, no, they make it look too easy.
I bet they were very good. Yes, and made it look very
Oh, they were
easy.
wonderful. And
Yeah.
this sounds horribly sexist, and I apologize, but the women got it.
Mm-hmm.
You see how some of the male players,
Mm-hmm.
when some little kids come up to them,
Mm-hmm.
they don't even want to bother with them.
Mm-hmm. Mm-hmm.
The women on the national team really got it. I
Yeah.
remember one time, my oldest was the ball girl for Gold Cup, and all the kids gather around, and there was one little girl who was just being, not maliciously, but pushed out of the way because she was 7 years old.
Yeah.
At the end, when the girls had to go back and actually play a game, Lexi, my daughter, yelled over and said, "Brandy, could you come sign this girl's ball?" Because the poor little girl had been waiting there so patiently. Now, she could have said, "Look, I don't have time." But she literally said, "Lex, I've got to go out." No, she said, "I'm going to be busy for the next 90 minutes. Have her wait for me, and after the game, I'll come back." And you would think she's blowing her off.
Right.
At the end of the game, after they had their warm down, she came back. Lexi found the little girl, and this young lady, Brandy Chastain,
I
signed.
thought you said Brandy.
Yeah, she signed a ball and brought a shirt.
That's awesome.
My little A-Rod, Amy Rodriguez, took kids out on the field.
Mm-hmm.
And for the kids, when they were 10, 12, it was a big deal
Yes.
to have the, players they see on TV,
Yes.
come get them, walk them around the field. And you just felt like they understand that they're not just players.
Yeah.
They're really, what they did for that little 7-year-old, she'll never forget.
Mm-hmm. Mm-hmm. Yeah, they were ambassadors of the sport. I don't know the whole reason. You noted like women versus men. I don't know the whole reason, but I do think part of it is women recognize that need to grow the sport, right? So Title IX back in the 70s was the beginning of all of this. So it's new. It's relatively new that women can be playing at a high level and have fans in the stands. And so I think they recognize the more they interact with the fans, the more they can grow their sport. So I
Well, the
think
soccer league got caught
yeah,
in their own jargon.
yeah,
Because for the longest time, the reason we got these women living with us is that they were being paid $40,000 to $50,000 a year. So they couldn't afford to have their home at home and a home in Boston.
yep,
Um,
yep.
And the logic was always, well, the men's sport generates all the money. And you sit there and say, I'm not quite on board with that, but there is I'll give you some logic.
Yeah,
Then the World Cup comes and they find out that the women are earning so much less,
Yep.
but generating so much more revenue.
yep.
So it's like, okay, now what's your excuse?
And they didn't have one, and now there's equal pay.
Now they have, which
Took a while.
at this time in our life to say, isn't it great we have equal pay,
I know.
seems kind of silly.
I would agree with you.
It's
would
just,
agree with you.
you sit there and say, why is that something we
Yeah.
should be, well, you're happy that we're finally coming into equality,
Yes, yes, yes.
but it's embarrassing to say it took till what year?
Yeah, that it's sort of a novelty. So
And
yeah,
see,
you that.
I
Yep.
benefited so much because the girls really loved having the women from the U.S. national team
Yeah.
come to Milford.
So cool.
And there was always a joke that, okay, if I'm feeding you, you're working. So they would have to run my practice because I was coaching soccer.
That's awesome.
So, of course, the tough part is you try and get them to do certain drills like headers and all.
Yeah,
It was like pulling teeth. when Kelly or Amy would ask them,
Of course.
they do it instantly.
Yep, yep, yep.
So how did you choose, of everything you could have picked, to go into sports medicine?
It's a good question. It evolved. A lot of my life decisions have just evolved. We were talking earlier. I majored in chemistry in college and I actually thought I would be a chemistry professor, and didn't enjoy bench lab work, and thought to myself, what on earth am I going to do with my life? And I said that to my soccer captain on a bus trip, who was applying to medical school herself, and she's like, why don't you take the MCAT and see what happens? So I took the MCAT, and the score was good enough to apply. So I applied, and I got in. And so I sort of follow where it takes me. And I've played soccer my whole life. I've been involved in sports my whole life. I really enjoyed musculoskeletal medicine. I took a rotation my fourth year at UMass Medical School in musculoskeletal medicine, and I still use things today that I learned there. And then when I went off to residency, there was a very good sports medicine fellowship at my residency. So I went into family medicine, and there was a great sports medicine fellowship up at Maine Medical Center, which is where I did family medicine. And so I started, working with them, volunteering, covering teams and games, and applied and got in, and that was that. So it was sort of a natural progression. I guess I would say it reflects who I am.
But there's got to be a passion there, because first of all, you have to have a passion
Yes.
to go through, how do you put this politely? To go through the school you do and come out at almost retirement age before you start working.
Yes. Sports are my passion in that sense. When you say it like that, yes, sports are absolutely my passion. Like, I just think sports are extraordinarily valuable, especially being a little bit older, for females, because my generation was the first generation to really have all the opportunity of organized sport. And I think the things that sport and exercise give to people, whether it's younger people on teams learning, kind of life lesson stuff, or simply physical and mental health because people are out there moving. I think that sport and exercise, it just gives people so much. And so I myself I love exercising, running, snowshoeing, skiing, soccer. I pretend I can do a little hockey. To me, it's such an important part of life. So I think that's where the passion comes from. I see people, and I want to know, what do you do for exercise? What do you do for movement? Why does this hurt? When does this hurt? How can we get you moving? How can we get you back to the things that you want to be doing? All that.
So now,
yeah.
if I want to help my legs, my knees, am I better off using a treadmill or an exercise bike? Or does it matter?
That's a good question. My first instinct was to say exercise bike, because there's no impact. And impact can be harder on arthritis. But the reality is, there's no study that says that running causes arthritis.
Oh, really?
Really. So I think what I would say is, whatever one you enjoy. The one you'll do 5 days a week. Whichever one you'll do 5 days a week. Or mix it up if you like them both.
And you don't need the fancy version. Like I say, I have the poor man's walker and the poor man, treadmill.
Yes.
Where I put a TV in front of the treadmill and a TV in front of the bike.
Yep. Yeah, like I said before, put on sneakers, go outside. You don't even need a treadmill. You could have a regular bike with a trainer where you lift the wheel up in the back and just theoretically have your road bike and ride on that. So, yeah, you can keep it simple and keep moving.
So now I move up and I say arms, shoulders. What's the next most common injury above the waist?
Shoulder. Definitely shoulder stuff, because the shoulder's such a mobile joint. So if you think about the anatomy of the shoulder, the ball and socket of the shoulder, the ball is the upper arm, the socket is actually part of the shoulder blade, right? And then the shoulder blade just sits on your back, attached by muscles. And it's attached in the front by this little connection with the collarbone. And so it's super mobile, and there's just a ton of different directions it can move in. But that means it's very easy to injure it and very easy to throw it off balance. So let's see. So in younger people, little kids don't get shoulder stuff. And then teenagers and stuff, a lot of collarbone fractures, someone skateboarding or on a scooter or playing football, they fracture their collarbone. AC separation is actually a sprain of where the collarbone meets the shoulder blade up top.
Now, wait a minute. You said it's just sitting on my back held with muscles.
Yeah.
So when you hear somebody threw out their shoulder,
Yeah.
what
Yeah.
does that really mean?
That probably doesn't have an exact synonym medically. Maybe they mean they dislocated it, because
Okay.
you can pop the upper arm bone out from the socket side of the joint. So maybe they mean they dislocated it.
So if they
another reason.
dislocated their shoulder, what do you do to undislocate it?
So typically, there's a typical direction that it dislocates in, and then there's a typical maneuver that you would do to relocate it. Depends on the setting. If you're on the side, so I used to work at Boston College, and I was on the sidelines. The first thing you would try would be relocating it just on the sidelines and see what you could do.
So that's not just TV thing where this manly man just grabs it and
If it goes easily, like you don't want to have to try too hard. So if you can apply the right sort of angle and traction and it just pops back in, you're good. But if it's more than that, then then you go to an emergency room and do X-ray and sometimes muscle relaxants so that you can get it back into place.
so you got to meet Jeff Hopkins.
I know Jeff Hopkins very well myself. I went to medical school with him.
Ah.
We graduated in the same class. He's a great guy. So,
He's been on the show a number of times, and we know a lot of people that he's helped out
yeah.
in his new Taj Hopkins ER room.
Taj Hopkins. I love it. I'll have to say that to him. That's funny. Taj Hopkins. He's
So
great.
the
Yes.
shoulder being dislocated.
Yes.
Now, is that a very bad injury, or
Sometimes yes, sometimes no. It depends on the scenario. Some people have a condition called multidirectional instability, and they can just pop it out. Those people who are like, they have a trick shoulder, they're like, watch this. Yeah, have you ever had anyone do that?
no?
So that's called multidirectional instability, where they can just pop it out. And so those people, they're unstable and they can get into trouble with it, but it just pops in and out all the time. But you can have a big dislocation where you tear the labrum, which is a cartilage rim around the joint, and then the labrum, if it's a bad enough tear, might need surgery. So it varies, but dislocation isn't terrible. It doesn't necessarily
Now,
lead
do
to
you stop
arthritis.
at the surgery? Is it then, hey, Mike, your turn?
Yes. Hey Mike, or John Mulroy, or Glenn Gaby, Susan Barrett. Here
Well,
you
if
go.
the other two are as good as Mulroy and Mike,
Yeah, they're great. actually.
my hat's off,
They are both actually really great.
because it's bad enough when you have to go yourself, but when I had to take my sainted mother, because her knees had worn down to her, was like, pardon the term, bone on bone,
Yeah, that's bone on bone
and it was scary to
Yeah.
take an 80-year-old lady
to the hospital.
to have
It is.
surgery.
It is.
But then 2 weeks later, or 3 weeks later, she was like, do the other one now.
I love it.
It was like, this one's good now. Now do this one.
That's the number one thing you hear after a joint replacement. I should have done it sooner, because there's so much pain before, and then it feels better after.
Yeah, but how do you know? How do you know when?
Yeah.
By the time I went to see Mike, it was, a knee that big. I could say, something's not right there.
How do you know? It has to do with living your life. You know what I mean? Like if you can't sleep, if you can't get around, if the pain is just too much that it's consuming your life, then it's probably time.
But is that too late? I
No.
mean, should you check with your primary care when you're going for your normal physical to say, hey, the arm, the knee, the leg isn't like it used to be. It's not terrible,
Yeah,
but it isn't like it used to be.
yeah. I would mention it, and then they can ask you a few questions that might say, "Oh, give it time. Just do some exercise, or maybe we'll refer you over to somebody." Yeah, people should always mention concerns to their primary care doctor.
So dislocating your shoulder is a big one.
Yeah.
Elbows,
Elbows don't tend to dislocate, but you might see. Well, the real common one is tennis elbow, golfer's elbow, right? Just pain.
yeah, what's that?
Yeah. So there's 2 points, right, on the kind of sides of the elbows. On one side, the muscles that lift your hand hook on. On the other side, the muscles that bring your hand down hook on. And so any sport where you do this repeatedly, tennis, golf, can inflame that connection there and that connection there. And so it can be stubborn to get better. It's just inflammation that then turns into a little tendon. Tendon is how muscle hooks to bone. A little like tendon, what's the word? We call it tendinosis now. Sort of abnormal tendon.
But can't I just take an anti-inflammatory and life gets better?
You can try. And if that works, that's great. And then you don't have to come see us. But if not, then people get into doing things like a strap or massage, some strengthening exercises. Depends on how it goes. So that's common. It's a common one.
Now, when Dr. Velasquez, when Mike came on the show,
Yeah.
he said something that he doesn't do hands, or back then
Mm-hmm.
there was a specialist for hands.
Yes. Yes. So as if someone like Mike hadn't gone to school enough, you can do additional training after orthopedics and do hand orthopedics. And so they learn all of ortho, and then they learn the hand specifically. And then usually they practice doing usually elbow and hand and wrist at that point. And it's just because it's such an intricate part of the body. I mean, if you think about how your fingers work, right? Like, it's very intricate. And so it's useful to have that kind of knowledge.
Is there
Training.
something like, I never thought of my hands as getting hurt.
Yeah.
But I played hockey.
Yeah.
So,
Never got slashed?
yeah, but I had
Never
gloves.
fell on a stick? Fall on
Yeah.
a stick. You can break in here if you fall like this on your
I hadn't
stick.
thought about that.
Yeah, right in there. That's a hand one in hockey. Getting
The
slashed.
slash,
Yeah.
to me, that was just annoying.
Yes. Yes.
And again, it was playing with 20-year-olds. They believe they're still immortal. So
Yes.
I had one kid just turn around and two-hand right across the face, full swing. And I looked at him, I said, I was a little more colorful. But the implication was, are you out of your mind? If I didn't have a cage on,
Right.
you could have killed me.
Right.
But they never think about it.
Right. 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 Yes. 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 I have no words for that. They shouldn't be doing that.
No, but you start thinking about your hand, and
Yeah.
I mean, everybody has heard of carpal tunnel syndrome.
Yep. Carpal tunnel. Other stuff. Mallet finger. So more common maybe a basketball player. If the finger is sort of stretched out, but something hits the end
Oh,
and forces it bent while you're actively trying to straighten it, you can pull that tendon right off this bone here, and then you can't straighten it out anymore. It's called mallet finger. So that's an injury. More like I said, basketball, like something where you could get hit end on like that. There's something called jersey finger, where you can get your finger caught and tear, like a tendon in the other
if you
direction.
said jersey finger to me,
Jersey
I would
finger.
think it's a non-nice number
Would
one.
have something to do with the middle finger.
Yeah.
What's other stuff? You can get injury to the thumb. So if you think about your thumb joint, you rely on a lot of stability in this direction, right? You can only grasp something if you have good stability along here. And there's something called gamekeeper's thumb, where you can tear the ligament here, and if you tear that, you lose stability, so it's hard to like pick things up. So that's an injury that you might see in like rugby. I mean, you can see it from like work-related injury too, but like rugby, anything with the hand, football, like in a receiver or something like that, catching the ball.
I would think their biggest worry is having 300-pound Mamadukes.
Yes. Yes.
These monster
Yeah.
linemen and
Yeah.
stuff jumping on your bones.
Yeah, you could not pay me to play football. Not that it's really an option, but that is a sport that I would not enjoy.
It's just amazing, 'cause you start seeing 300, 350
They're
pounds.
so big, even at the high school level now.
Yeah.
It's amazing. Yep.
Is there any sport that you see more injuries from? I mean, I always thought hockey would be worse than soccer,
Yeah.
but when I moved to indoor soccer, I was playing goalie. I felt like Wile E. Coyote, where you jump up, you make the save, and then you want to hold up a sign that says, "Oh,"
Yes.
because now you know you're going down.
Yes. Yeah. It's point blank on indoor soccer. It's so close. So it's interesting. There's some old NCAA data that says the most dangerous thing is cheerleading for concussions, I guess. Cheerleading. Then I think it was women's soccer and then football. So soccer actually is like somewhat dangerous.
Is that because of headers?
Yeah,
Or
because of head injuries and neck injuries and that kind of stuff. I know.
It's
It's just it's headers, but it's not the heading of the ball. It's when two people go for a header, right? And they crash
Oh.
into each other, or you go for a header and you hit the post, or the goalie punches
I was
you
worried
in the
about
head.
Parkinson. Because when you think about your brain sloshing around, one
Yeah.
one night we had dinner with a fellow, Muhammad Ali, was at the next table, and he could barely talk.
Yeah.
And
Yeah.
when you figure out that the force, because the people he played with
Yeah.
were not the most gentle people,
No.
and you think of how many hits he took to the head,
Right.
and now you
Right.
just looked at him and it was like unbelievable.
Yeah. Yeah. So, there's a condition, chronic traumatic encephalopathy, or CTE. I think you're right that Muhammad Ali was maybe officially diagnosed with Parkinson's.
Yes.
But you have to wonder about CTE too, because it was not really a thing back when he was diagnosed. But so chronic traumatic encephalopathy seems to be related to
Well,
recurrent head injury.
It was at a fundraiser for Parkinson's. My
Yeah.
wife used to work with this kid, Michael J. Fox, and he ran every year
Yeah.
a fundraiser,
Yeah.
and he had all these stars come in to
Yeah.
raise money.
Yeah.
And the next table over
Was Muhammad Ali.
was, so we got talking, but you couldn't really have a conversation.
Yeah.
You almost felt sorry.
Yeah. Yeah.
Now, I'm reading the paper Sunday,
Yes.
and I see this big article that the next sport to generate traumatic injuries will be pickleball.
I thought that's what you were going to say. Yes.
Pickleball?
So, I heard about that too. And I actually haven't seen any pickleball injuries yet. But, anything that people just pick up and start playing, especially, I think it is geared towards older people, right? Because you don't have to move quite as much.
Is tennis.
So, yeah, it's like little tennis, right? It's like small tennis. So, we'll see injuries. But honestly, if people are getting out there and moving, that's what matters. I want people to be safe, but I don't think it's a
Well, it
dangerous
sounds
sport.
like your message is get moving and just
Yeah.
move the way you like it.
Yep.
And try and minimize.
Yep.
Don't play goalie if you're my age. Because when you catch the ball in the air,
Yep.
yeah, it's like Wile E. Coyote again. Down you're going.
Yeah. Or play goalie with people your age, right? Because they probably don't kick the ball as hard as a 20-year-old. So.
The Brazilians did.
Some people are very talented.
I remember getting a call by a group of people I knew said they needed a goalie.
Mhm.
I should have known when they say we need a goalie.
First question should have been, why don't you have one?
Well, the first game we played, I lost by 8 goals, and I'm feeling embarrassed.
Yeah.
And they're excited because it was the first time it was under 2 digits.
Oh, gosh.
And then we started bringing in friends who were Portuguese and Brazilian, and all of a sudden, we started winning games. Of course, the funny part was trying to convince some of these Brazilian players that defense is allowed to stay on our side of the field. Playing defense, they thought it meant center field and forward.
Yeah.
I
What
got
is it? The best defense is a good offense?
Oh, yeah. I got a lot of practice at breakaways, and they were always good. They said, don't worry, if they score, we'll score 2 more.
That's funny.
So
Good strategy.
from that end, it was exciting to just be back on the field.
Yeah.
And people had a lot more sense.
Yep.
When I played Monday with the young kids, and there were fights on the rink. It's like, come on.
Yes. Yes.
Wednesdays was over
Yes.
35,
Yes.
which was still too young for me, but
But better.
they didn't fight.
Right.
They had to go to work too.
Right. Right. That's why I love my over 30 soccer. There's none of that. People are careful to not get injured. They play, they go hard, they want to play, but they don't want to get injured either. Yeah.
So what brought you to Milford?
Yeah. So, the job. But the job came because...
Yeah, but it sounds like you could have had a job anywhere.
The job, so what I was hoping to do, so I worked at Boston College for 16 years, and I worked in the health services, and I worked with the athletes, and it was amazing, and I loved the work, except that it meant a lot of nights, a lot of weekends, a lot of travel. I was just not home very much, and after 16 years and having at the time they made the decision, a 10-year-old son, I just felt like I needed more time at home. So I was starting to entertain, how do I do the work I really enjoy, but not in the college setting? Through some contacts and that kind of thing, it seemed like maybe there was a need here in Milford for that, because there are already 2 primary care sports docs, Dr. Andrea and Dr. Gilson. But I would be bringing to the table a little more of like the sideline stuff and the athlete stuff. And so there seemed to be a need. And so I spoke, with folks out here, and kind of the job was developed. And that brought me here. Now, I was familiar with Milford because I'd gone to UMass. I'd done a few rotations at the hospital. I'd actually done a rotation way back when the ER was like, the nurses' station was like this, and I think there were like 8 rooms.
Yes.
And now it's, what did you call it? The Hopkins?
The Taj Mahopkins.
The Taj Mahopkins. So I knew it way back when. So I knew Milford, and then my husband actually works in Milford Hospital as a pediatric hospitalist, and he loves the community. So much so when I was thinking about switching work and had an opportunity to maybe move further away, he said, no, I'm not leaving this job. He loved it that much. And so then I said, okay, then I'll have to find something.
We're very fortunate. I mean, Frank Sava and now Ed Kelly.
Yes.
Both have had the same philosophy.
Yeah.
Because I remember when I was born, it was the Little Red Hospital. It was a little tiny hospital 100 yards from my house. I mean, to this day we still laugh because they had certain rules.
Yeah.
Like only 2 visitors per patient.
Okay.
You'd be amazed, when you talk about Portuguese influence.
Yeah.
There was always a Portuguese grandmother working in the hospital.
Right.
So there was always a door left open, and the other Portuguese grandmothers would flood in. So you'd go upstairs, and there'd be like 8 of these women just sitting, because it was the thing to do, to show your support.
Yeah.
And I'll never forget, I walked in once, and the floor nurse, the woman who was in charge of the floor,
Yeah.
said, you have to help them understand that there can only be 2 of them. And all of them are looking, including my sainted mother, saying, no speaking Ingy. And I looked at them, because my mother had been in Milford 40 years.
Right.
And one of them said in Portuguese, you rat us out, you die.
That's lovely. That's like a sign of the community, right?
And, now the level of care we can get in Milford is amazing.
Yeah.
Absolutely amazing. Something that, Ed Kelly, our CEO, brings up the fact that most community hospitals, if they had one allegiance with a medical center,
Yeah.
would be overly proud, and they should be.
Yep.
And then we turn around and say, we have 4. And I think he does the UMass one because he gets to steal all the people that are coming to work.
Yeah. There's a lot of UMass graduates.
And
in the
then
Milford
I
area.
just love the idea when some of the docs and nurses come on, when they refer to, I've not been here as long as all my colleagues. How long have you been here? Only 23 years.
Right. It's awesome. It's awesome.
It's just such a great
awesome.
feeling,
Yeah.
and when they went to build out the ER and all, when they said they were going to raise $25 million from the community,
Yeah.
that's amazing for a little town like Milford.
It
At least
sure is. Yes. Yeah.
So what are the biggest challenges you think you're going to be facing as you go forward?
Oh, good question. I never think about that. I miss optimism. I'm always like, everything's going to be great. I don't know. I miss optimism. Everything's going to be great. I mean, right now, because I'm brand new, like I have like appointment slots that are open that I'd love to fill. I mean, that's like a focus at the moment, but that's like hopefully short-lived. I don't know. I'll face the challenges as they come.
Tell me,
Yeah.
they mentioned something that at first it sounded like, how are you curing communism? There's a red disease. I said, what does reds have to do with the sports medicine?
Yeah, I don't know. What did we say at the beginning? Oh, we were talking about
Treating reds.
Oh, red S. Yeah.
Oh, red S.
I'm sorry. I thought you were talking about, remember we talked about the Romanian deadlifts.
Yeah, no. It's
No,
red
no.
S, and
Red
I'm
S.
sitting there saying, wait a minute.
What is this?
Don't
Yes.
cure red S. Milford's red. We like red.
You like red. Relative energy deficiency syndrome is what red S stands for. It was formerly something called female athlete triad, but we've learned that it actually pertains to male athletes as well. So it's unique to, well, I shouldn't say you see it a lot in endurance athletes, people who run long distances, do triathlons, that kind of thing. But it can happen in other groups as well. And the idea is that it's when people underfuel for the exercise they're doing. Like say your daughter were to train for a marathon, you have to start to eat more. You need more carbs, proteins, fats, because you're trying to train your body to get faster, stronger, more efficient. And if you just train without the fueling, you'll break your body down and you'll end up injured.
Is that why people cheat and inject EPO? And
Kind of. It's in that same family. People in endurance sports, a lot of times they think lighter is faster. Like, so EPO is about like getting more oxygen around, right? But like the red S stuff is about like people underfueling because they think if they get lighter, they'll get faster. But the problem is and to a point they do, but then they're too light and they're too underfueled and their body either breaks or they don't have enough fuel. And it becomes, a big problem in training.
well, if you need energy and you don't have fat, the body's going to go after muscle.
Exactly.
And things like heart
Exactly.
are muscle.
Exactly.
So it's not like you think of liposomal storage disease, where you're born with a lack of an enzyme.
Yep.
This is self-induced, this red thing.
Effectively, yeah. Effectively. I mean, people aren't trying to harm themselves. It's usually due to a lack of education. They just think if they are lighter, they'll go faster and they'll be easier to do their event or their sport or something. So it comes down to lack of education. And yeah.
But again, if they consult their primary care.
Right.
And I got to admit, when they said she's dealing with red S, I said, well, that's communism, red. Or it's Milford High, red. We like red.
Yes. So interesting. It's interesting you say that because in this day and age, a lot of people are overweight or obese. So when
Yes, rotund.
So when someone goes to their doctor and they're maybe like the lighter side of normal or even underweight, we see a lot of doctors who are just like, okay, good, you're not obese. Like it's almost habit, right? Because they're so used to every patient being obese. It's like, oh, you're not obese, great. But they're not realizing, oh, there could be a problem on the other end that they're.
That's like a therapeutic range where you can have a low end,
low normal,
yep. Or the toxic above a certain.
Yep.
Was it vitamin A was the famous one that nobody thinks too much vitamin A is a problem?
Right. This is like a med school question. Vitamins A, D, E, and K are water soluble, so they tend to be less dangerous because you just pee them out. Do I remember that correctly?
Other way.
Is it the other way around? Are they
Yes.
fat soluble, A, D, E, and K?
A, D, E.
And K?
I can't remember K, but A, D. C is water soluble.
Yes. Oh, yeah. Good point. C's definitely
C's water soluble.
So maybe they're fat
Ascorbic,
soluble.
but
Yeah.
I remember A, D. Yes.
A, D, E, and K. Fat
We
soluble.
used isooctane to analyze it, so it's fat soluble.
Fat soluble. But there's something else you said that I wanted to respond to. The vitamins, the doctor. Oh, the range. Classically, 18.5 to 25 of a BMI. BMI is the number that we try to use a little more nowadays. But even BMI isn't super accurate. Like you take a real strong hockey player, they'll often have a BMI over 25, which would be considered overweight, but they're just all muscle, so they have a higher BMI.
But now, the body mass index.
Yeah.
How do you know? I mean, are there tables that you say, at your age, you should be? Because everything looks at me and says, every index, fat old man.
So it is not age related. Your BMI should be your BMI for your lifetime, but I would, people do definitely naturally gain weight as they age, for sure.
But the exercise, again, comes down to do something.
Yep, do something. Just move.
Dr. Shine just says, I don't want to hear it. Just pick something you like.
Yep.
Do 30 minutes 5 days a week.
Yep.
And you'll come out better than if you don't do anything.
Yep. Agreed, 100%.
He won't believe that I listen, but I actually listen.
You did listen. It's excellent. And I agree, 100%.
Any final words to leave with people?
Just get moving. That's it. Just get moving.
Well, we appreciate you coming on and dealing with certain areas that we didn't know what a red S was. But overall, it sounds like whatever you like, just get moving
Yes.
and keep moving.
Yes.
And actually, like I
Yes.
said, now that my daughter put the TV in front of the machine, I feel like that donkey with the carrot.
Yes.
You know,
Yes.
it's there it
Yes.
is. I can just keep
Yes.
striving to.
Whatever gets you out there, whatever gets you moving. Just
Well,
do it.
thank you for joining us, and thank you for helping us.
Thank you for having me.
Obviously, this is a critical area. I joke about being rotund, but even fat old man like me is trying to lose weight because it's just a healthy thing to do. And it becomes more and more important as we get older. But take a look and see what's available, because the little hospital, the little red building that was the Milford Hospital is now the Milford Regional Medical Center. And a lot of the things, a lot of the programs that we never thought you could get locally are available. Access to talent, like Miss Amy here, Dr. Amy, is available locally. Take advantage of it. And as always, to our 6 loyal viewers, may God bless. May tomorrow be a better day than today.
Far too long since I've been home. Been running all my life just